Well, welcome everyone to our town hall meeting. We're fortunate today to have some outstanding speakers with us to answer your questions about the federal, state, and local response to COVID-19. You'll be hearing from Congressmember Ted Lieu, State Senator Ben Allen, Assemblymember Al Marisucci, Dr. Shai Roy, and Pat Nye. I am Stacy Armato, council member in Hermosa Beach, and I've been working with our council and our city staff on our local response to the COVID pandemic here in Hermosa. But before we launch into questions, I want to make sure to formally introduce all of our speakers today. I want to first introduce Congressmember Lieu, who represents California's 33rd Congressional District. Congressmember?
Well, thank you, Stacy. And it's an honor to be on here with Representative Marisucci and Senator Allen. And thank you, Shai, for providing your expertise. I'm going to give you a quick update on the 3 bipartisan laws that Congress has passed to address this pandemic, and then I'm happy to answer any questions that you may have. The first law we passed provided billions of dollars for vaccine research and also research to do drug therapies to try to find a cure for the coronavirus. The second law we passed provided emergency and paid leave to a number of Americans. It also mandated that testing for coronavirus must be free. And it also provided monies for hospitals and hospital systems. And then the third law was the CARE stimulus package. We provided stimulus checks to millions of Americans. We expanded unemployment insurance to include $600 extra per week for 4 months. We also expanded the kinds of people that can apply for unemployment insurance, including those who are independent contractors, those who work in a gig economy, and self-employed individuals. We also provided over $100 billion to hospitals and hospital systems to help these hospitals get the PPE that they need. And lastly, we also put in money for their Paycheck Protection Program that Congress created to give loans out to small businesses. There's other provisions in that bill I'm happy to answer questions about, and just want to let you know that our district office and capital office were open. We're operating remotely. So if you have any specific issues accessing aid from federal agencies or any issues with federal agencies, please contact me or my district office and we will help you. And so thank you for having me on and look forward to answering your questions.
Thank you for that update, Congressmember Lieu. Next up, I'd like to introduce Senator Ben Allen, who represents California Senate District 26. I think you're muted, Senator Allen.
Okay, unmute. There we go. Okay.
There you go.
Well, thank you so much, Stacy. Appreciate you helping to pull this all together, and it's such a pleasure to be with everyone here this afternoon. I certainly wish it were under different circumstances. You know, very strange times for sure, but we're managing to adapt in some pretty spectacular ways in some respects. So I want to thank everyone who's been part of this. Obviously, my great colleagues, Congressman Lieu and Al Marisucci, Shai Roy, who's on here as well, Pat Nye. Your insight and your advocacy have been so critical, and I just want to say that I feel like the South Bay is very fortunate to have your leadership. So as you know, COVID-19 continues to run its course through our state. We've been under a safer at home orders now for nearly a month, and it's not lost on me just what a sacrifice these last 4 weeks have been. I certainly have been spend a little bit too much time within these 4 walls than I would have anticipated. Our plans, our goals, our travel, the connection with other people, the face-to-face connection in person that we crave so badly, our routines, our finances, maybe in some cases our health, have been turned upside down by this current crisis. Just for the numbers that were announced by the governor today, California's seen nearly 27,000 infections, now nearly 900 deaths. But I will say that our work in our collective work, and this means really everybody, staying at home has made a big difference. I remember just even a couple of weeks ago how frightened we were of where things may go. And you look at what's happened in New York and Louisiana, and you look at where we were headed on some of those projections in terms of the extent to which our ICU infrastructure was going to be strained, our hospital beds infrastructure were going to be strained. And we now are at a place where where we're not facing those same kinds of fears. We're even in a place where the governors felt comfortable enough donating, lending at least some of our ventilators to other states to help them address the challenges of this crisis, which is such a good sign, because from where we were just a few weeks ago, I don't think anyone would have anticipated that we would have been in such a strong place. So that's a real accomplishment that I think all of us can be proud of, because we're all part of that achievement. I think if we continue to do our part in these next couple of weeks, we really can expect to see a phasing in of reopening measures. California has enacted several, and we'll talk a little bit about the reopening measures, because it's going to be, I think what you're going to see is that we're not going to just sort of, it's not going to be like turning on a switch. I think the governor put it this way. It's not going to be like turning on a switch. It's going to be almost like, upping the dimmer a little bit. We're going to have to take measures that are going to be reflective of the continuing need to not reopen the door for a resurgence of the virus. But there have been a couple things that the state has done to help people stay afloat during this current crisis. So that includes everything from a 90-day extension to file the California tax returns, authorizing local governments to halt evictions for renters and homeowners, ramping up our hospital infrastructure to handle the surge in patients. We've waived waiting periods for unemployment insurance to allow folks to apply quickly and hear back as soon as possible. Now nearly 3 million Californians have applied for unemployment insurance. I know many of us are concerned about how that's all happening. That's probably the number one. I'm sure Al is in the same situation, at least at the state level. We're getting tons of calls about unemployment insurance. All we can say is they are dramatically trying to ramp up to address an unprecedented demand on their services. And we just kind of ask people to be both patient and persistent in helping to make sure they come to help you. But we all know that everyone's really concerned about financial futures, whether you own a small business or you're a freelancer, and we're certainly all going to be taking some questions on that issue. Hope to clarify some of the information about the loans and other options that are out there for people. Anyway, it's a wild time. I just want to say that while our offices are physically closed, I know that I speak for all of my colleagues. Our staff are working 24/7. We are answering phones. We are answering emails. We're truly working full time to try to provide any and all assistance that people may require. And very much look forward to this town hall, and hope this will be helpful for folks as they manage this difficult time.
Well, thank you for that update, Senator Allen. And next up, I'd like to introduce Assemblymember Marisucci, who represents the 66th Assembly District. Assemblymember Marisucci.
Thank you, Stacy, and good afternoon, everyone. I'm Al Marisucci, and I have the privilege of representing, along with Senator Allen, the South Bay and the California State Legislature. I want to thank everyone for joining this virtual town hall. It's just hard to believe that it was just only a month ago that Governor Newsom announced our statewide stay-at-home order, because I think for all of us, our lives have been literally turned upside down. I know that there are a lot of people out there who are really hurting, and a lot of people that are really scared. My office has been receiving, just like Senator Allen said, we've been receiving hundreds of calls and emails from our South Bay neighbors, people who are not only worried about the virus, but people losing their jobs, people who are worried about losing their small businesses, people who can't pay their rent or their mortgage. We have the parents, the families who are struggling to make distance learning work, families that don't have computers or the internet, families that count on the meals that are provided by our public schools. So, I want to emphasize that along with Congressman Lieu and Senator Allen and Councilwoman Armato, our jobs, my job, my office's job, is to do everything we can to help all of you during this crisis. For those of us who live in the South Bay, we're very blessed to have so many great hospitals and so many dedicated frontline healthcare workers, as well as dedicated first responders, grocery clerks, mail carriers, all the essential workers that are continuing to do their jobs during this pandemic. But I think we're going to talk more about this in this town hall, but we still have a long and rough road ahead. But I want to emphasize that we are beginning to see some rays of hope. Thanks to the sacrifices that we've all been making this past month, staying at home to save lives, we are bending the curve. We're slowing the spread of this virus so that we save lives and so that our hospitals and healthcare workers are not overwhelmed beyond their capacity. But until we come up with a vaccine or treatment for COVID-19, the road back to normal is going to have to be very careful and very data-driven. Like the governor said just a few days ago, we can't just flip the switch and go back to normal. We need to make decisions based on science and not on politics. The biggest obstacle, as far as I'm concerned, to restarting our economy is testing. California is working hard to ramp up our testing capacity. I was just on a conference call with one of the co-chairs of our state task force on testing. And we, in the South Bay, we now have a number of options for COVID-19 testing, as well as antibody testing. We'll talk about that later on. We also have some of the world's leading biomed companies and the world's best universities right here in California working hard to develop a vaccine, to develop treatment for COVID-19. But until someone comes up with the vaccine and until we ramp up significantly our testing, we're going to have to continue with our physical distancing, and we need to keep bending the curve. So let's hang in there, everyone. We will get through this together. Thank you.
Thank you, Assemblymember Marisucci. Next up, we have a special guest, Dr. Shai Roy, who serves as the president of the Los Angeles County Medical Board Association. Dr. Roy?
Hey, thank you very much for having me, inviting me, and thank you to the Congress member and state senator and state assembly person for your great leadership. I want to start by thanking our state leaders. The response throughout the country obviously has been disparate based on where you are, and we've had tremendous leadership in our state and in our city. And the social distancing measures that were implemented early and aggressively in our city and in our county have made a big difference and made an impact. We are seeing a lot of cases in LA County. We've had about 10,000 cases so far that have been tracked as positive COVID cases in LA County, and around 400 deaths. And so this continues to be a large impact on our hospital systems. That being said, we are seeing a flattening of the curve. We are seeing hospitals being able to treat COVID patients and not being overwhelmed to the same degree that we're seeing in other localities, for example, in New York. So, as a message to the general public, this is very, very difficult, but the discipline that people are showing in adhering to these guidelines really is making a difference. And we're pitching in not just for ourselves, but we're pitching in for our family members. We're pitching in for our grandparents. We're pitching in for everybody in our community. And so I, as a healthcare provider, I just want to say thank you to the general public for really making a difference on this. The number one thing from the medical community right now, as we're about to enter into the second month of addressing this crisis, continues to be PPE. And at LA County Medical Association, we continue to advocate and work hard to make sure that our community providers and our hospital systems and all healthcare workers, whether they're physicians, nurses, staff members, anybody who goes into a healthcare setting, and it's a large group of people, we want to make sure that they're protected, and that's the number one thing that we're working on and advocating for is PPE, particularly masks and gowns for our frontline workers. So again, thank you for having me. Thank you for your leadership, and I'm happy to participate for any more questions.
Thank you, Dr. Roy, and thank you for your commitment on the front lines on this pandemic. Finally, I'd like to introduce Pat Nye, Regional Director for the Los Angeles Small Business Development Network. Pat?
Yeah, hi. I want to thank everybody for joining the call, and I appreciate the legislators for putting this on. The Los Angeles Regional Small Business Development Center, we're both a federal and state funded program that has business experts to work hand in hand with small businesses, navigating whatever resources are available and whatever things they may need to help their businesses thrive. Um, Over the past few weeks, we've been on the front line of all of the loan programs put out by the SBA, and we've had a number of successes through that. I know there are challenges today with the application process being closed off, but we're happy to report that a number of businesses throughout our region have been able to secure some funding. And we're not limited to just the SBA funding. There's also a state loan guarantee program that we want to support, as well as other more local resources. We have a daily webinar that we put on where businesses can go and get questions answered in real time. And then we can always provide you with one-on-one advising for your specific business if you come to one of our centers. And I can share a slide that has some of that information.
Terrific. Thank you, Pat, and thank you for the work that you're doing on behalf and with our small businesses that need this help so much right now. Thank you again all for participating in this town hall. We have questions that have been submitted by our constituents that I'll be asking each of you. And I think we're going to start with a question for Congressmember Lieu. Congressmember Lieu, this is about stimulus checks, and it's from Danny Simpson. If an individual didn't earn enough to file taxes in 2018 or 2019 and is not currently collecting disability or doesn't have any other source of income, are they eligible for any part of the stimulus? And if so, how might they file an application?
Thank you, Danny, for that question. Let me first explain how the stimulus check program works. The short answer is yes, the person will get a stimulus check. So the way it works is if you are a single filer and you make less than $75,000 in adjusted gross income, you will get a $1,200 stimulus check and $500 per child. If you're married, then it's less than $150,000 in adjusted gross income. If you make up to $99,000 as a single filer, you will also get a stimulus check, but it will be prorated. And that goes up to $198,000 of adjusted gross income if you're married. And for a family of four, if you make less than $218,000 combined, you will get some sort of stimulus check. In addition, if you're an SSI recipient and others who don't get income, you will also get a stimulus check. If you have direct deposit, it will go into your bank account directly. If you don't, then you're going to get a physical check. Unfortunately, some of those checks are going to be potentially delayed because the president has insisted to put his name in the memo section on that check. And then for people who aren't in either of those two categories, you will still get a stimulus check. And the way you do it is the IRS has set up a web portal. I'm going to give you the web address. It's www.irs.gov/economic-impact-payments. We're also going to put that web portal on our Facebook, and you can then go to that link and enter your information, and you also get a stimulus check. So that's how the program works.
Terrific. Thank you, Congressmember Lieu. Next question I have is for Senator Allen. The topic is unemployment. What is being done to increase EDD's capacity to meet the unprecedented demands placed on it? And when can we expect to see our payouts? Senator Allen, you're muted right now.
Okay.
There we go.
There we go. Great question. I mean, as I mentioned in my opening remarks, an unprecedented number of people have applied for unemployment insurance, and it's completely overwhelmed the system. You know, in this, if you think about it, the system, even in a bad recession, the the number of people applying kind of slowly ticks up. Whereas in the case of the current crisis, the economy was shut down and immediately everyone needed to apply. And so I think they've taken more claims in the last 2 weeks than they took in all of 2019 combined. And so just logistically, it's been incredibly challenging. They've had to put a lot of resources into meeting this demand. And I know how frustrating it can be. I've personally taken calls from people, and I have friends who are in a situation where they need help and they're struggling to get through. So the governor's heard, so the legislature has been beating this drum because we've been hearing so much about it from our constituents. I know Al knows this as well. And the governor took action. He just helped to move an additional 740 employees over to the department to help process claims. They've just announced that starting on Monday, they are now expanding real call center hours. It used to be you could only call and get a person on the other line for 4 hours a day. Starting on Monday, you'll be able to call anytime between 8 a.m. and 8 p.m., 12 hours, 7 days a week, by the way. There will be people manning those call centers. And so you'll be able to talk to a real person anytime, 8 a.m. to 8 p.m. starting on Monday, 7 days a week. So that's important. Now, historically, it's taken 3 weeks for Californians to receive their first benefit payment of unemployment insurance. The state has made a strong commitment to ensure that we maintain that very same timeline because we know how badly folks need these benefits. In some cases, it's getting out a little earlier, but at the very least, there's been a strong commitment made to meeting that 3 week timeline. Sometimes it may take longer if there are issues with verifying identity or work records. So if you've applied for these benefits, please pay very close attention to your mail for any responses from the department, making sure all your paperwork is complete. The last thing you need is for there to be some paperwork problem, and that slows down your access. Just one thing, I think it may bear some description because I know a lot of people are confused out there. There's three primary benefits that we're talking about right now: unemployment insurance, pandemic unemployment insurance, the PUA, and the CARES Act. So, unemployment insurance is traditionally available for traditional W-2 workers who have lost their jobs. And that makes up, that usually is about half a year, 26 weeks, up to $450 per week based on circumstances. Now that of course could grow. Pandemic unemployment insurance assistance, or the PUA, is anyone who doesn't qualify for traditional unemployment insurance. So that's independent contractors, self-employed, gig workers, et cetera. And they're now offering up to 39 weeks, $600 per week. I know Ted can talk a little bit about that later. And then of course there's the CARES Act, which is the kind of broader stimulus funds. That's for everybody who is under, I think, 150,000 for joint filing income, and that's going to that's 13 weeks, $600 per week, can be layered onto UI or PUA. So there are different things that are available, and we're happy to get into more details as people have questions.
Terrific. I know that was a question we had from a lot of constituents, so thank you for answering that question, Senator Allen. Next, we have a question for Assemblymember Marisucci. It's about testing. There's two parts to this question. I'll ask you the first one. Where in the South Bay can I be tested for COVID-19, and how long may it take to get the results?
All right, thank you for the question. So, after the statewide stay-at-home order was issued, I reached out to all of our major South Bay healthcare providers, including, I believe, where Dr. Roy works, Harbor UCLA County Hospital, as well as Torrance Memorial, Little Company of Mary Torrance, Kaiser South Bay, UCLA Health, the Beach Cities Health District, and others. And everyone has been working real hard to expand testing, especially in recent weeks. We now have a number of options in the South Bay. Maybe I can give like a top line, and Dr. Roy, you can talk about what you're seeing on the ground level, on the front lines. But the information that was provided to me is that although we have a number of options, most of the testing is still limited to those showing symptoms, with priority being given to those over age 65 and those with pre-existing medical conditions. All of these options require appointments, So you need to contact your primary care physician, your healthcare provider first. We are in the South Bay. We're very fortunate to have one of the few public drive-through testing sites in the South Bay at the South Bay Galleria on the corner of Artesia and Hawthorne. You can go to the LA County website, covid19county.gov/testing to make an appointment, or you can contact any one of our offices with help on that. Kaiser, South Bay, and Harbor City, they have been and continue to be providing drive-through testing for members. But again, it's important to call first to make an appointment. UCLA Health, they are providing drive-through testing by appointment at the Beach City Health District campus. We also received a report that the Palos Verdes Medical Group has been providing drive-through testing by appointment on the top floor of the Peninsula Shopping Center parking lot in Palos Verdes. As for how long it takes to get results, it depends on the test provider and the lab testing backlog. And so you need to contact the healthcare provider from which you are seeking to get the test from. Dr. Roy, do you have any, what are you seeing on the front lines?
Sure. So most of the testing is still focused on symptomatic patients. The major symptoms to look out for in terms of in terms of suspicion for COVID-19, obviously, number one is a known exposure to somebody who is positive with COVID-19. But other common symptoms are fever, shortness of breath, also loss of sensation in terms of smelling sensation and taste sensation. And so most of our testing capacity is focused on those patients with those symptoms. What I would advise patients to do, what the general public to do, is if you want to get tested, you think you should get tested, then the best thing to do is go to the website that Assemblymember Meritsuchi suggested, and or call your healthcare provider to see if you're a good candidate for testing currently. Over the coming weeks to months, we're hopeful that testing will be expanded with antibody testing, where there will be larger numbers of asymptomatic patients that are tested. And that's where we're hopeful that that's the really big hope for the economy, I think, for the rest of the year, is once we are able to accommodate testing for large numbers of asymptomatic people, then we can have a testing strategy to open up commerce to some degree based on the results of that testing. But right now, we don't have that testing capacity quite yet. And so we're still focused on symptomatic patients. But again, please reach out if you feel that you should be tested, because there is testing available.
All right, and thank you, Dr. Roy. And the second part of the question was, what is happening with antibody testing in the area? And is there anywhere to get that done? Is that something you could answer, or assembly member? It's certainly a hot topic.
So in terms of antibody testing, it is available in the county. The issue with antibody testing is the testing kits, the testing apparatus can be variable. So there is antibody testing out there that has not been properly approved or certified by the FDA. And so that is available. And then there is antibody testing that's potentially using the FDA certified kits. You can go to ladocs.org/coronavirus. And if you are interested in antibody testing, we can type a message into there. It's our LA County Medical Association site, and we can connect you to Department of Public Health to get more information about it. But it still needs proper certification. And then the supply chain issue is a big one. And so we need to get the proper amount of tests to test large swaths of the population before it's really effective on a public health scale.
Understood. Thank you. Assemblymember Succi, did you have anything else you wanted to add on that topic?
Yes, just real briefly, I had a chance to talk with our public health director, Dr. Ferrer, yesterday, and she was talking about what I think many of us have been hearing about. The LA County Department of Public Health and USC, they conducted a study where they took a random sample of 1,000 LA County residents with this antibody testing. That was, it's a study, so the sample had to be randomized, and so there's no way to sign up for that testing as of yet. I did also want to mention, although I personally haven't verified this yet, but again, the Palos Verdes Medical Group has been advertising that they are performing antibody testing at the Peninsula Shopping Center in the South Bay. So that may be another option. You can check out their website.
Terrific. Thank you, Assemblymember Marisucci and Dr. Roy, for answering that question. Next question is for Congressmember Lieu. The topic is unemployment insurance, and it's from Kyle On. Will self-employed people like Uber drivers that support their family, like my father, get UI unemployment insurance? Congressmember?
Thank you, Kyle, for that question. The short answer is yes. So Congress expanded the unemployment insurance program not only to provide an additional $600 per week for 4 months, but also to the kinds of applicants that can get unemployment insurance to now include people who work in the gig economy, people who are independent contractors, those who are self-employed, and that would include Uber and Lyft drivers. A problem is that because we expanded this in the CARES Act, and it's never been done before, the federal agency has to write guidance and regulations to all the states on how to implement it. And now the states have to learn how to implement it. So there has been a delay just because of capacity issues. Many states are getting a massive surge in unemployment applications on a scale they've never experienced before. They just don't have their people available to process all these claims. So it's going to take some time, but the answer is yes. Lyft and Uber drivers can access these funds. It's just getting the federal guidance to the states and then the states implementing it. That's going to take a little bit of time, but we're all working together to make sure we get that money out as soon as we can.
Thank you, Congressmember Lieu. That is a great update, although maybe a little delayed. They should still expect those payments. Next question is for Senator Allen. You can unmute now. All right. The topic is rent and mortgages. What is being done to balance the needs for tenants to have rent protections and for landlords to still be able to pay their mortgages?
Yeah. Well, I think the question does a good job of expressing the difficult balance that the government is struggling to meet right now. Obviously there's a lot of renters who are hurting a tremendous amount, literally cannot afford to pay their rent. That's all absolutely true. And at the same time, we have landlords who have bills to pay and mortgages to meet. And so how do we strike that balance in the proper way? Obviously, the first thing I would say is for those renters who have not lost their job, who have not seen a significant diminution in their income as a result of this crisis, you really need to pay your rent and keep the system running. You have no excuse not to pay. But obviously, we know there are some who are in an incredibly difficult situation, and what we don't need right now is for there to be mass evictions up and down the state. We already have a homelessness challenge. We already have a housing crisis. And the last thing we need is to have people out in the streets, especially during a time when we need people to be at home. So it's a tough issue. And let me just kind of go through some of what's happened in this area so far. Obviously, people know that on middle of March 16th, I think it was, Governor Newsom authorized local governments to halt evictions of commercial and residential renters and homeowners. So allowing folks like Stacy, who serve on a city council, to set their own rules locally. On March 27th, he came back and enacted a partial statewide moratorium on residential evictions, which means that literally people cannot be turned out of their houses during the current crisis. Our state courts actually went further. They passed a series of emergency regulations that, in almost all instances, pauses the unlawful detainer process that landlords must engage in to enforce an eviction. So I know there have been some calls for a statewide rent holiday. Just to clarify, Governor Newsom's orders have been very clear. Renters have not been relieved from eventually having to make up for any payments that they miss. Different local jurisdictions, including in my district, are passing ordinances that give tenants a reasonable time frame to catch up on rent. But no government in California at any level has taken away the right of landlords to eventually collect that which they are due. In some cases, local governments have, though, created mechanisms for renters to get some additional support, some additional help, and I'll talk about that in a second. The one thing I will say, there are those landlords that do own their rental property outright, but they're the exception, not the rule. If a landlord doesn't make his or her mortgage payment on time, then the bank or lender will eventually foreclose on the apartment building. So, any true intervention has to balance protections for renters with accommodations for landlords and mortgage holders too. One of the things that's really important is that the governor has secured a commitment from all national banks, except for Bank of America, we'll talk about that, and all state banks and credit unions to provide a 90-day mortgage forbearance for California homeowners who provide documentation that they've been economically impacted by the virus, and that would include landlords as well. Bank of America has offered 30 days. We're hoping to encourage them to go up to 90. But the governor's moratorium on eviction specifically bans the enforcement of eviction orders for renters who are affected by COVID through May 31st. It prohibits landlords from evicting tenants for non-payment of rent, prohibits enforcement of evictions by law enforcement or courts, and it requires that tenants declare in writing no more than 7 days after the rent comes due that the tenant cannot pay all or part of their rent due to COVID-19. Now, there's some good news here, and that's that just now, April 14th, LA County has announced its plans to create an emergency rent assistance program for the COVID crisis that I think will help a lot of the renters on the call. This will provide up to $1,000 per month for 3 months to renters who've lost income due to the coronavirus pandemic. The county's implemented a rent freeze and eviction moratorium. However, obviously renters are still going to, as I say, they're still going to have to pay back rent owed in the months after the crisis. But the funding is going to come from the CARES Act. Thank you, Congressman Lieu. And additional funding can come from some philanthropy and private sources. So they're hard at work trying to create this fund right now, but that will hopefully make a big difference for renters who might not be able to pay their full rent, but if they're able to get this additional $1,000 for rent supports under this new rent assistance program, that should be very helpful to them. And so we're going to make sure that information gets out to the people on this call about this new program so that they can get the money they need to pay their rent and keep the system running and stay in their homes and safe and sound.
I appreciate that update. That was thorough and informative for many, many people that were asking those questions. I quickly want to toss it over to Pat Nye. It appears he may have to jump off of the call. Pat, do you have any closing thoughts from your end?
Yes, and I did want to share a slide. This shows the resources of the Los Angeles Regional SBDC Network. I encourage everybody to go to our website. We have lots of different resources there, including that daily webinar that I mentioned where small businesses and entrepreneurs can get their questions answered in real time. Or they should go to the site or call one of those numbers to get lined up with a business advisor for one-on-one advising. We can help you secure resources that are available today, as well as help navigate strategies for pivoting your business and potentially figuring out what your business might look like in the next 6 to 12 months. So these are no-cost resources funded both federally and through the state, and we encourage all small businesses and entrepreneurs to take advantage of these resources.
Thank you very much, Pat. Thank you for the work that you're doing, and thank you for participating in this town hall. I'm going to go back to the constituent questions now. Next up is a question for Assembly Member Marisucci, and it's about our seniors. What options are there to assist seniors with their groceries and other errands, and who can I contact for help?
All right. So, we're again fortunate that a lot of people at the federal, state, local levels, volunteers, everyone's stepping up to try to help our seniors, as well as those with pre-existing medical conditions, people that really shouldn't be out doing their grocery shopping or running other errands. They should be staying home, to save lives. And so there are a number of options for seniors to help with their groceries and errands. Number one, I want to emphasize or remind folks that if there are folks that out there on the call that have problems in affording, meals, we have our state CalFresh debit card program. You want to make sure that you get the assistance from the CalFresh program to make sure that you can afford meals. LA County, ever since the pandemic started, they launched a critical delivery services program for groceries as well as household items. This is for people 60 and over, as well as disabilities. The cities, all the cities in the South Bay, they all have some type of senior meal program. Like, for example, the city of LA, they just launched, the Angelino card program. I'm not sure. I think I might have seen some news that they might have run out of those cards already because the demand has been so overwhelming. But on top of that, different cities have their senior nutrition programs. The city of Torrance, for example, they have a Torrance Cares to Go care package program where the city puts together these pre-selected grocery items in a care package for seniors, those with disabilities, as well as those with health conditions. These care packages include milk, eggs, and toilet paper, among other things. The Torrance YMCA, they're doing a senior meal delivery program, $3 a meal, serving Torrance, Lomita, and Gardena. City of Gardena, they have their Meals on Wheels, as well as their city Senior Citizens Bureau has a home delivery meals program. Lomita has a Meals on Wheels program. The beach cities, of course, I was talking with Tom Backley with the Beach Cities Health District, and he was talking about their senior assistance hotline, where they launched to help the older adults in the beach cities. And he joked that in typical beach cities fashion, at the early stage at least, they had more volunteers than there was need. But I'm sure people can take good advantage of that program. Palos Verdes, the cities on the hill, they have a number of programs, as well as some volunteer programs. People all pitching in to try to help out our seniors and the medically vulnerable. Please contact our offices, Congressman Lieu, Senator Allen, or my office, the city of Hermosa Beach, Councilwoman Armato, and all of our cities for specific programs serving your community. Last but not least, there was a tremendous local push to get senior only shopping hours at our grocery stores. I know that my favorite Trader Joe's, they set aside the senior only grocery hours, as well as so many other grocery chains. So please make sure to contact them for that information also.
Thank you, Assemblymember Marisucci, for outlining all of those resources for our seniors. I know here locally in Hermosa, we have close to 300 volunteers that have been partnering with the Beach Cities Health District, and we're finding that there are so many people that want to volunteer, and we're looking for people to help. So I'm glad you were able to give out that information. The next question I have is for Congress Member Lieu, and it's about CARES 2. Question comes from Tegan. Why are Dems holding hostage $250 billion for the emergency extension of the Paycheck Protection Program for small businesses that'll be depleted Friday until Senate Majority Leader acquiesces to Dems' pork barrel projects?
Thank you for that question. We're not holding anything hostage. In fact, we have legislation that will provide $250 billion to the Paycheck Protection Program, as well as $100 billion for hospitals that are also running out of money, and additional $150 billion to states and local cities that are running out of money. At the same time, we want to make some changes to the Paycheck Protection Program. We've gotten reports that hedge funds and other businesses who probably shouldn't be getting access to these loans are getting access. At the same time, we have a number of small businesses who can't get access to the Paycheck Protection Program, either because they don't have a existing relationship with a bank or have an existing loan with a bank that does the SBA loans. And we have a number of small businesses that are getting shut out. So we want to make changes based on the rollout that we've seen from the Treasury Department. And instead of just throwing additional money into a program that can work better, we want to make it work better. So we have legislation, and actually it's Senator McConnell holding it hostage. He won't allow that legislation on the floor of the Senate. If he did, it would pass. So we're trying to work together with Senator McConnell. I know the first 3 laws we passed were bipartisan. I believe we can get this done on a bipartisan basis as well, especially because we now have a bipartisan request from our nation's governors, both Republican and Democratic, saying they desperately need funding for their states. And so the Democratic legislation has all of that, and we make the Paycheck Protection Program better. I see no reason why McConnell is holding it hostage. That's what we're negotiating right now.
That's terrific. Thank you, Congressmember Lieu. We've had so many small businesses that have been denied funding through the Paycheck Protection Program. So thank you for looking out for them. Next question is for Senator Allen. The topic is mental health. What kind of support is available to people who feel overwhelmed or on edge about the implications of COVID-19? And what about for people who are put at risk by the safer at home orders?
Okay. Great question. Certainly something that's on a lot of our minds. The California Surgeon General has been doing a great job of talking about this issue. This was actually the key focus of the governor's daily press briefing just a couple of days ago. And the Surgeon General played a big role in talking about stress management and talking about, actually the Surgeon General released these stress management playbooks for individuals, for caregivers, for kids. All of them are available on the covid19.ca.gov website. We're all going to mention this over and over again, but covid19.ca.gov. The Surgeon General talked about 6 strategies that they're all obvious, but I think they really do bear repeating. Maintaining supportive relationships. I know, incredibly difficult, especially for those of us who are alone right now. But even, even if we're all together, remembering what we love about our family members and making sure to strengthen those relationships as we're at home. Engaging in physical activity every day, not easy, but very important for people to do. Getting high quality sleep. Oftentimes they're tied in with each other. Ensuring we get proper nutrition, getting mental health support. There are a lot of things that are now available online in that space, practicing mindfulness, etc. There's been a dramatic expansion in telehealth capacity, including the ability for folks to receive mental health care while at home. A lot of people getting therapy and all that sort of thing online. So the covid19.ca.gov website has all sorts of emotional health resources. It includes information for our 24-hour suicide prevention, domestic violence hotlines. There is also a bunch of hotlines and text lines that are specific to different needs in different sections of our society. Youth and teens, there's a special line for them, veterans, first responders, older Californians, folks who are deaf or hard of hearing, LGBTQ individuals, people who may be suffering from substance abuse disorders. And the website also includes a safety planning guide for survivors of intimate partner violence, as well as housing resources for domestic violence victims. Unfortunately, we've seen an uptick in calls in that area as people are spending a lot more time shut in with each other, unfortunately. So the state has launched this Stay Home, Save Lives check-in campaign to combat social isolation and food insecurity amongst older Californians. It includes a statewide hotline, which is 833-544-2374. So 833-544-2374. In coordination with the 211 system, which helps older Californians access grocery and medication delivery. I'll also say, if you are interested in volunteering, there's need for you. And there's a Cal Volunteer has a website, and we'll post all of this information in the chat. But we need people who are willing to help with food delivery. We need people who are willing to help with blood contributions, maybe a little less so now, but we still have some need. And then we also are going to need people to help with check-ins. People who might want to volunteer for telephonic or video check-ins with older people or people who are shut in or alone, just to check in and say hi and give them a smile. And we're working with some of our friends in the faith community to build out a volunteer program in that space. So, and then finally, I will also say, if you're having any kind of, feelings that your sadness or depression or anxiety gets you to a place where you may want to do harm to yourself or others, please call the National Suicide Prevention Hotline at 1-800-273-8255, 800-273-8255. As I say, we'll post, there's a bunch of different numbers, including disaster distress helpline and California peer run warm line and the domestic violence hotline. But I do also want to mention the crisis text line. If you text HOME, HOME, to 741-741, texting HOME to 741-741, there's 24/7 crisis support. You'll get a call back and help with any sort of mental health or anxiety challenges that you're facing right now in this crisis. Please do not hesitate to reach out. We need you, and we need everyone to stay strong.
Can I weigh in for 1 second?
Absolutely, Dr. Roy.
And so
Yes.
those are great points, Ben. And I just want to let the general public know, please don't hesitate to reach out to the medical community. There's a lot of hesitancy to reach out right now because people feel like they should just be at home and forego their medical care because of the COVID response. The state has incentivized and the community physicians have really expanded in a very short-term manner the use of telemedicine. And so mental health is something that can be dealt with optimally with the use of telehealth. And so primary care physicians can certainly be utilized. If you think you need to talk to somebody, you have a history of mental illness, or even if this is something new, this is something that primary care physicians absolutely deal with. And so I would just implore you to call your local primary care physician and set up a telemedicine appointment for this purpose. And so just please don't hesitate to reach out.
Thank you, Dr. Roy, and thank you, Senator Allen, for addressing a sensitive but important topic. Next question is for Assemblymember Marisucci, and it's on the topic of education. Is there any discussion of making up for the lost part of the school year for students? Is summer school an option? Assemblymember?
Thank you. My daughter is standing right outside of the camera view, and she's trying to lobby me to not support summer school. But I think it's a question that's been on all parents' minds. As we see our educators working hard to try to make distance learning work. We fully appreciate how they've had to turn on a dime to adjust to this new reality of distance learning. But I think we still see the tremendous challenges of making distance learning work. First of all, many communities, as I stated earlier, that don't even have computers and internet access. But even for those who are fortunate to have those resources, it's just suddenly parents are being asked to be like homeschoolers, homeschooling educators to support the efforts to make distance learning possible. And so, I brought this up with the state superintendent of public instruction. He said he would look into it. I also, reached out to talk to our South Bay superintendents, and I was greeted with varying responses. I know that there are some school districts. The Palos Verdes superintendent indicated that he was exploring the possibility of having some kind of a summer makeup school for some of the lost instructional time during this distance learning period. But there are other districts that reminded me that these are very these are decisions that are really up to your local school district, up to your local superintendent and school boards, because these arrangements, there's a lot of work. As a former Torrance school board member, I know this, but there's a lot of work that goes into planning for summer school, and on top of that, there needs to be negotiations between the school district and the employee unions in terms of the calendar year. The dollars that we have for our school districts are finite, and given the economic downturn, we're looking, unfortunately, to the very real possibility of having to make school budget cuts for starting in August. And so it's a goal that we all would like to work towards, to try to make sure that our students are not losing out during this difficult time of distance learning. But it's really something that needs to be worked out at the local level with our local school districts, their local school boards, and their employee unions.
All right. Well, thank you, Assemblymember Marisucci. We will reach out to our local school districts to see what they decide on summer learning. And speaking as a parent that has 3 children and trying to juggle working from home and also homeschooling, I can attest to the difficulty of balancing that. But we're all in this together. So one day at a time here. Our next question, or I'm just giving a little bit of a time check. I've been told that we have an extension until 3:15, that everyone seems to be available. So we're gonna maybe not rapid fire, but go through the next couple questions here. Next question is for Congress Member Lieu, and the topic is financial support for local medical facilities. The question is from Debbie Stigura. The University of California is key in the COVID-19 battle. What are you doing to ensure its medical centers are getting the CARES money already approved and positioning the University of California to share in the upcoming measures that would provide financial relief?
Thank you, Debbie, for that question. I had the opportunity to speak with Chancellor Block earlier this week. The CARES Act provided over $100 billion to hospitals and hospital systems, including places like UCLA Hospital. CARES Act also had $14 billion for institutions of higher learning, colleges and universities. So UCLA specifically got $18 million to help its students, an additional $18 million for the school, for a total of $36 million. And then it's also getting a tranche of money for its hospital. And we're trying to do everything we can for places like UCLA, as well as other hospitals. I know that PPE has been a problem, and so we've been trying to not only get additional funding through various congressional laws, but also really working with administration to try to get the PPE delivered. In terms of what I think should happen is we should have a national federalized supply chain, because otherwise what you have instead is 50 states bidding against each other to get the PPE. You've got hospitals bidding against other hospitals to get their protective equipment. And then that not only jacks up the costs, is also not efficient, because it means that the hospitals that get it are the ones that can pay for it, not necessarily the ones that actually need it. So if we had a centralized, nationalized sort of supply chain, then we can actually deliver the PPE to the hotspots and make sure that every hospital has what it needs. Specifically back to UCLA, there's some good news there. They've been selected as one of 75 sites globally to go into a clinical trial on antiviral medication to see if it can work against COVID-19. Their bioengineers have also recently developed a reusable face mask that they've now approved, and it's now part of the NIH 3D printing bank. And so what we see here is really not just a whole government approach, but a whole society approach where everyone is coming together, working together to address this pandemic, whether it's our heroes on the front lines like doctors and nurses and medical professionals, or those in other parts of society who are all pulling together in the same direction to really fight against this pandemic.
Thank you, Congressmember Lieu. We have our next question for Senator Allen, and the topic is reopening California. One of the hardest parts about this pandemic is not knowing how long we will be in the lockdown. What is the timeline for reopening the state, and how can we ensure that reopening won't lead to another surge in COVID-19 cases and deaths?
Yeah, great question, and certainly on everybody's minds. You know, the big fear, of course, is that if we reopen the economy too quickly or prematurely, it could lead to a resurgence, which would make all of this hard work and the suffering and the pain that we've gone through over the last month or two to basically be for naught. And that's the great lesson epidemiologically from the 1918 flu pandemic, where they did a really good job of containing and then reopened too quickly, and there was a resurgence. And so we don't want to see that happen here. The governor talked about this extensively during his press conference earlier this week on this topic, and he talked about 6 key factors. And I got my newspaper here from yesterday. So expanding testing. So the idea being that each of these factors are going to be what he uses to make his decision about the extent to which and the moment at which we reopen. So it's going to be based on the extent to which we've been able to dramatically expand testing, which of course has proven so far to be a real logistical challenge. The extent to which we can ensure that we can protect high-risk groups, including seniors, the medically vulnerable, people in facilities like nursing homes, ensuring that our hospitals have enough beds and supplies to care for patients, progress in developing treatments, both direct medicine, vaccine, et cetera, the ability of our schools and our businesses to support physical distancing. I'm going to talk a little bit about that. And then, of course, the ability to decide whether to reinstitute stay-at-home orders if needed. So this is the kind of, the governor talks about, as I said before, it's not going to be switching on a light switch. It's going to be, upping the dimmer a little bit, right? So the idea that there's things are going to go to normal one day when they were not normal the day before is not what's going to happen. And to be honest, I think, unfortunately, we've all been to our last concert for quite some time, at least a packed concert. There are certain types of activities that are going to be much harder for us to get back online because of fears of of resurgence, unless and until we have a vaccine. Once we have a vaccine, I think then things are going to be in a different place. Al and I were on a fascinating call yesterday with the chief public health officer for LA County, Dr. Ferrer, we're really very fortunate to have serving us in LA. And she talked about how she's actually going to be engaging in focus groups with all sorts of different agents, with different industries, where they're going to bring in people from that business or that sector with epidemiologists on Zoom calls, just like this, but maybe 10 people, just small groups of people, to talk about how to get the most bang for buck in terms of that sector being able to reopen, while also making sure that reopening doesn't add to the resurgence of COVID-19. So basically getting some smart people around the table to think creatively about how to let sectors reopen in a way that will be responsible. So what does that look like? I don't know. Restaurants and gathering spaces maybe having less seating available, maybe masks continuing to be required, maybe having you can reopen Disneyland, but everyone would have to stay at Disneyland Hotel and be checked, have their temperature checked the day before, and have less people there. And, things like that. Maybe you can, restart our sports leagues, but with far fewer people in the audience. who are spaced out, things like that are going to make a difference in making sure that we don't reopen aspects of the economy that are going to act as vectors for a resurgence in the virus. So I was joking to a friend yesterday that like the one of the you know how we have traffic consultants for CEQA analyses and that kind of thing. Well, what's really going to be in demand now is epidemiological consultants, people who can help businesses, sectors, unions, whatever organization, better understand the epidemiological, the virology ramifications of business decisions and help them figure out ways to mitigate and to re-up their businesses, but doing so in a way that will be responsible in light of a potential resurgence of COVID.
Thank you, Senator Allen, and I'm grateful to hear that we're working on that plan and we're thinking about it. It's one of the top questions we get asked on the local level, and we're looking to you all as leaders in helping us pave that way towards the new normal. So thank you for that. Our next question is for Assemblymember Marisucci. Get ready for it, because this is a big question in Hermosa Beach. I can almost guarantee this came in from someone here locally. And it's about beach access. Is there any way for the beaches to be reopened, ... or at least for residents around the area? Assembly member.
Well, Stacy, as you just indicated, I mean, you are on the front lines of these conversations. And for me, as a fellow South Bay resident, I mean, I one of the best things I love about the South Bay are our beaches. I always, would go surfing or go jogging around Avenue C and Redondo Beach, and now we can't do that. And this ties into our earlier conversation about mental health and how so many of us find that peace and solace from being able to take a walk on the beach or going for a swim, going for surfing. The bottom line is that our beaches are just too good and too attractive to keep away the crowds of people that we saw in the 2 weekends before LA County shut down all of our beaches for public access. Because I mean, we have real life examples. I mean, we saw all those college kids that went to Florida for spring break, and I read an article about how there were like 70 University of Texas kids that went out to Florida for spring break, and 40 of them came back with COVID-19. So unfortunately, because the enforcement of social distancing is just too difficult to to even make that distinction between residents versus non-residents. I think that's why we've had to make the unfortunate but necessary choice to close down our beaches in LA County, to save lives.
Thank you, Assemblymember Marisucci. I've reached the end of our questions at the moment because I want to give each of you time for a minute or two of closing remarks. I'll start with Congressmember Lieu.
Thank you, Stacy, for your excellent job moderating this virtual town hall. And it's been an honor to be on with Representative Marisucci and Senator Allen, as well as Shai. And I want to first of all say that I'm very grateful for our heroes out there who are on the front lines fighting against this pandemic. The doctors, the nurses, the medical workers, they are putting their health and lives at risk every day to treat patients who have COVID-19, as well as being grateful to other grocery workers and pharmacists and those who deliver our food and every other person who's working right now so that we can be at home. Those are our heroes, and we need to support them in every way that we can. I want people to understand that we can deliver unemployment checks to those who are laid off. We can deliver stimulus checks to those who are on SSI. We can deliver distance learning. We can deliver loans to small businesses. but we cannot bring the dead back to life. And so we're simply going to make a choice as a government that we're going to prioritize the health and lives of Americans and of Californians. And I believe that is a right choice. Everyone on this town hall believes that is a right choice. And that's basically going to be our guiding principle. At the same time, we do have to reopen our economy as soon as we can. The only way to do that effectively is to go to mass testing, nationwide testing, because COVID-19 is not distributed evenly across America. There are areas where there's a lot of this virus spreading. There are areas where there's not very much indication of this virus. If you had nationwide testing at scale, you could figure that out. And then those areas where you don't see a lot of evidence of the viral activity, you can start opening up those geographic areas. We're not there yet. And that's why we keep pushing this administration to increase the number of tests and to increase testing. Unfortunately, we've had a 30% drop in testing over last week. We're going exactly the wrong direction. So we keep focusing on trying to get the administration to get these tests out. And I also want to say that all of us are working very well on a government basis in terms of local officials, state officials, county officials, and federal officials working together. And a lot of it has been bipartisan. I've written 2 letters to the White House Coronavirus Task Force chaired by Mike Pence. Both of those letters started out with the same 2 words, which were thank you. And so you see a lot of cooperation now, and that's going to continue as we all fight this pandemic. And at the end of the day, we are all Americans and we're going to prevail. Thanks for having me on.
Thank you, Congressmember Lieu, for your leadership. Next up, Senator Allen.
Well, I really appreciate this opportunity to get together with folks and talk some shop. And I want to, first of all, reiterate the call. I know I speak for my colleagues. Reach out to us. Our offices are open. We are anxious to help you if you're having any kind of challenge associated with the current crisis. And I know that I speak for a congressman, for our assembly member, for our friends in local government like Stacy, and our friends like Shai at the Medical Association. I know there were a couple things that we were going to talk about, but obviously everything went long. But I do want to say how I want to reiterate Ted's thanks to our grocery workers, to our frontline medical workers, all those people who are out there, in some respects, putting their lives on the line to help our society continue. Thank you to them. And if there are ways that you want to help and step up in your own way, I want to just put out some opportunities for people. First of all, I mentioned CaliforniaVolunteers.ca.gov is an opportunity to learn about volunteering opportunities that are available. CaliforniaVolunteers.ca.gov. If you have access to supplies that might help address the crisis, the state is taking all these offers in. COVID-19 supplies.ca.gov. So check that out. If you've got access to anything from a manufacturer to people who want to make donations, COVID-19 supplies.ca.gov. If you've been the victim of price gouging, we are very serious about clamping down on anybody who's trying to take advantage of the situation to gouge. And that includes rent price gouging. And the Office of the Attorney General here in the state of California is following up on all of these, all concerns in that area. OAG, Office of Attorney General, oag.ca.gov/consumers, if you want to report a case of price gouging. I know Diane Wallace had asked about the PUA, our Pandemic Unemployment Assistance. It should be up and ready in about 2 weeks. And so, we're hopeful that will be available for everybody. And certainly if you're having challenges, I know the Congressman's office, our offices are available to help. And then I guess the last thing I want to say is I think builds a little bit on what the Congressman was saying. This is an extraordinary moment. It's a moment where we are being tested as a society. And I do want to say that, this is a time for us to come together. There's been some really ugly things said about sectors of our society, about different types of people. There's no place for that in addressing this crisis. This is a moment for Americans to come together, for human beings to come together, quite frankly, and support global efforts to fight this pandemic. This is something that we're all in together. And we've shown that we're just as susceptible as everybody else. And so let's take this as a moment to reiterate and embrace our common humanity and come together as Americans, come together as human beings, recognize that we're all fighting this together, and hopefully build some community out of this crazy experience. And so I just want to, I do want to take a moment to encourage everybody to avoid blame and focus on solutions. And certainly for those of you who have, we've seen some ugly incidents of racism in this conversation as well that I can't more profoundly condemn. It's so unhelpful. It doesn't help us address the situation. It's also just morally bankrupt. And so anyhow, I thank everyone in our districts for stepping up, for complying with the orders. We're going to get through this. We're already showing success that goes way beyond what we've seen in other states, and it's because Californians have pulled together. And I'm just incredibly proud to be someone who's involved with this effort, alongside everybody on this call. And so thank you so much, and be in touch with us, and we just want to help.
Thank you, Senator Allen. Thank you also for your leadership, and in particular, your emphasis on your final point that we are absolutely in this all together. Assemblymember Marisucci.
Thank you, Councilwoman, and for moderating this excellent conversation that we've had today. I want to join my colleagues, Congressman Lieu and Senator Allen, in thanking Dr. Roy and all our frontline healthcare workers. You are our heroes. You are putting your lives on the line every day when you go to work to take care of us. We cannot thank you enough. I also want to extend my sincere appreciation to all our first responders. Just this past weekend, I joined one of our local South Bay citizens who made a significant donation of face masks to the Torrance Fire Department, and I know that one of their firefighters has been dealing with the challenge of getting blood plasma donations, and has received a tremendous amount of response from the community for donors, and so it just shows again that in this time of crisis, we are we have so many challenges, but we're also seeing so many people step up to help each other out, and so I want to really express my appreciation. I want to thank Senator Allen for raising the issue specifically on there's been a lot of hate crimes targeting Asian Americans because of this virus originating from Wuhan, China. And while we know that this is not limited to one country, this is not limited to one ethnicity. I mean, this is a global challenge, and I want to join my colleagues in making it absolutely clear that it is not acceptable. It is a crime. It is a hate crime with heightened criminal punishment for those that target people because of their race and ethnicity. And fortunately, like when I checked with the Torrance superintendent, he said that he hadn't heard of any incidents in the Torrance Unified community. But if anyone hears any issue about hate crimes targeting Asian Americans, please contact our offices, because we want to make sure that those people are held accountable. That is simply not acceptable. Finally, I just wanted to thank Congressman Lieu for being on the front lines of fighting for ramping up what I believe is the biggest obstacle to restarting our businesses, restarting our economy, which is ramping up our nationwide effort for dramatically ramping up testing. We cannot get back on the road to normal without dramatically expanding our testing capacity. California is really trying to step up to in the absence of the leadership from the Trump administration. States are having to step up, to scramble to come up with the PPEs, with the testing. And so we need to keep fighting these fights at the local, state, and national levels. But I think we are seeing the rays of hope. As I said in the beginning, we are seeing the curve bending. So many Americans are looking to California for leadership, and we want to show the rest of the country, if not the rest of the world, how to bend the curve and how to fight this virus together. I want to thank you all for allowing me to participate in this conversation.
Thank you so much, Assemblymember Marisucci, and for your terrific leadership during this difficult time. And finally, if Dr. Roy had any closing thoughts, we're maybe running a little bit over, but I want to make sure.
Sure, and I'll keep it short. Thank you, Congressmember Lieu, Senator Allen, and Assemblymember Marisucci for your leadership. I thank the general public at the very beginning for complying with the social restrictions. I just want to end as president of the LA County Medical Society to thank all healthcare workers, as my fellow leaders have done. It is a very, very stressful time inside hospitals, seeing patients, and to many degrees, people are putting themselves at personal risk to treat the patients that they normally serve. And so thank you to all healthcare workers in the county, throughout the nation, and of course, throughout the world.
Thank you, Dr. Roy, and thank you for your sacrifices of you and your colleagues and being there for all of us. We stay at home so that you can save us, and we really appreciate your sacrifices, and thank you for being a part of this town hall. I also want to quickly thank Pat and I for being a part of this conversation earlier and working so diligently with our small businesses. I want to thank all of you collectively so much for participating in this town hall. And while our time may be up or a little bit over, I wanted to let everyone know that's watching that we have they can contact all of your individual offices with any additional questions that may not have been answered in this town hall. Each of your staff is working full-time or more and will be available to all of your constituents. I think I speak for all of us here today when I say thank you to everyone watching for all that you've been doing to help slow the spread of COVID-19, whether you're staying at home to save lives or you're working the front lines on this pandemic. We so appreciate your contributions and your sacrifices. I also wanted to express our gratitude to our elected officials and our panelists for participating in this town hall. And thank you to everyone for taking the time to submit questions. Each of us has an important role to play. And of course, by working together, we can overcome this and get back on the path to recovery quicker. Thank you all for joining us today.
Thank you.
Thank you.